So I started surgery out of fellowship in 1983. So I've been around a little while. And in the mid 80s and late 80s, there was a buckling material called Miragel. It was a special, very soft material that during the initial trials seemed to be a terrific buckling material. But with time, what we learned about Miragel is it imbibes water and starts to swell. And it does it slowly over a course of years. In 5 to 10 years after implantation, we realized that these buckles were getting larger and larger and larger, and they just were continuing to grow. And the thing is that they don't stop. They just keep getting bigger and bigger and bigger. And they start to distort the eye, create all sorts of double vision, restriction of muscle motion. They can actually intrude into the eye. Some eyes were lost from it. Most of these buckles have been removed. We're now in 2019. So again, there's not a whole lot of Miragel buckles left around, but there still are some. And in this week, we saw another patient with it. They have to be removed once you see a patient where the eye is deformed, because they're just going to continue to grow. The trick is how to get these out. I think a couple pearls if you're faced with a patient with one of the Miragel buckles that's still around. The first thing to do is to do imaging. You need a CT scan and an MRI, both, in my opinion. The MRI really shows the buckling material well. It shows exactly how enlarged it is, where it went in the orbit. You'll be surprised how big these are and how big they've gotten within the orbit. And what you may see externally is not the whole picture. CT scan is also important because you also get osseous metaplasia. We saw a case of that about a year ago, where the whole buckle starts to envelop with a growth of bone around it, which also complicates its removal. Once you've got your imaging in a plan, and hopefully you don't see this growing into the eye, which really complicates the material because the sclera can necrose underneath these as well. Most of them are not hindered by an encircling silicone band, which makes it even more problematic. So if they've just been sewn onto the outside of the eye, they're free to expand away from the eye into the orbit, which is, again, the most common way you'll see these cases. And then how do you remove it? You open up the conjunctiva, you expose it. There's usually a fibrous cocoon over it, which is easy to snap open. And then you see this light gray color material. It has a very smooth surface to it. It's probably picked up 4 to 6 fold enlargement of its original size, and even beyond that. The problem is you can't grab it and remove it. It's very friable. So when you try to grab it and pull it out, it will crack away and you'll be left with just a small piece. The only way you really need to get this out is you have to come around from behind, and the goal is to push it out of the orbit from behind. It's been suggested that you can use a cryoprobe. I've tried that. You can cryo the surface of it. You can take an intravitreal cryo and push it into the substance of the buckle, then freeze it and try and pull it out. You just come away with small pieces. So again, you got to get behind it. You can use any instrument. I found a Q-tip works just as well. A spatula, the flat end of a Bart Parker blade handle. All these things are useful, but you curettes to remove chalazions. Again, you got to get from behind it to scoop it out. And again, the imaging helps you to show that you've got all of it out. You want to get it all out. I've had to remove muscles on a Miragel case to get the muscle away, to get it off the eye. And there's been some osseous metaplasia on the surface of the globe too. So be prepared for bone growth. Be prepared for these things to fragment when you pull it out. And the trick is to push it out. Don't try and grab it and pull it out.